would get a lot of calls. Somebody's had a heart attack, somebody's had a head injury, somebody's critical, and we are bringing them to Delhi. I would keep waiting for them all night and they wouldn't turn up, and I would get to speak to them in the morning, and I would hear words like, oh, the patient passed away on the way, he died on the way, and we turned back and now we are back in our villages. I would hear stories like, oh, maybe it's good that this person died on the way. The last one that did make it to Delhi stayed in hospital for 15 days. His wife had to sell their house, their fields. It's not just poor physical outcomes that you get if you stay in far-off communities, it is also the poor financial outcomes. More than 6 crore people slip below the poverty line every year in India just due to healthcare shocks. I dropped out of my super speciality course to start these hospitals in the small town. Started out with a very small single hospital, and now we have 20 hospitals across 5 states of North India, catering to all kinds of emergencies, serious illnesses, heart attacks, head injuries, intensive care, and all this at very high quality hospitals, and all this at costs that are less than 20% of what the big city hospitals have. Many people question us on how we make all this sustainable as a private enterprise, because we don't get aid or help from anyone, and we have private equity investors on board to answer to. So we started renting out buildings instead of buying a piece of land and building the hospital. That was the traditional way to go for most doctors. Second, we've successfully flipped the private healthcare model from a very low volume, high cost model that it traditionally has been to a very high volume, low cost model. And third, of course, financially it works very well for us, because the moment we cross a certain Rubicon of revenue and patients, most of the money then starts flowing into the bottom line. So we have been also the champions of the Ayushman Bharat scheme. We were the first corporate hospital to adopt that scheme wholeheartedly, when most corporate hospitals were very wary of it due to the lower prices. The first mitral valve surgery was done under the Ayushman Bharat scheme at one of our hospitals. Now we also do minimal invasive double valve replacements through open heart surgeries. We do bypasses through Ayushman. We do cancer treatments through Ayushman Bharat. Even though our main business is running hospitals, but we do try and make sure that people don't come to hospitals. So that is how our Sehat Chopal and our telemedicine programs were born. We go village to village screening patients during the Sehat Chopal. So we do almost 1 to 2 Chopals around each of our 20 hospitals every day. In each Chopal we will screen patients for tuberculosis, for eye diseases, for diabetes, hypertension, to make sure that their quality of life increases, and try and make sure that they never have to come to a hospital for complications of these diseases. Having treated more than 2.5 million patients till today, having done more than 150,000 surgeries till today, and those are the numbers that we are really proud of. We are looking to expand into 4 more states in the next 3 to 4 years. India has more than 783 districts, and unfortunately in more than 550 of those districts there is no tertiary healthcare available. People living in all those districts have to go out to their surrounding cities or faraway cities to access healthcare, and as I said, this leads to poor physical and financial outcomes, which we are doing our best to prevent.